G'day, my name's Chris Mitchell. I'm just going to be walking through a hypertension workflow that we've set up in Doctor's Control Panel. So high blood pressure is a really important and treatable risk factor for a range of cardiovascular disease and chronic kidney disease issues. And in my practice, like probably your practice, there are a reasonable number of people with hypertension that haven't really been coded or identified in our clinical information system, which means that we really can't provide the systematic care that they probably deserve. So what we've run is a task flow which I'll just walk you through. So here we've got a range of task flows that you can look through. This one's my task flow, Uncoded Hypertension. So what I've done here is I've chosen to do a search for people with last systolic readings over 160. I could have chosen 140, but I just wanted to start with a small group first. So Doctor's Control Panel is running through the Clinical Information System database and pulling out those people that do not have a coded diagnosis of hypertension but do have a last blood pressure reading over 160. That then gives me a list that we can work through, a patient list that we can work through and make sure that those matters are being addressed. Doctor's Control Panel already has some really neat functionality just in the normal clinical screen, where you can identify patients whose last systolic blood pressure was over 140. It has a little red flag. And it also has a function identifying patients with uncoded diagnosis of chronic kidney disease. Both of these are really useful in our next step. So what we can do now is that these are the list of patients. You can read down here what their most recent blood pressure actually was, and we can certainly see that a number of the patients in the practice have really got quite high blood pressures that aren't adequately controlled. And we can just work through each of these patients systematically, identify them and open up their file. So let's do that. And we can just have a look at what the last readings were. And we can look at the past history. And as we all know, high blood pressure shouldn't be diagnosed on the basis of one reading, but where there's multiple readings, it's perfectly reasonable for us to now code this patient with hypertension and then start an appropriate strategy in terms of managing her risk. Now, if we go back to the task flow, the other opportunity we've got through this task flow is an SMS functionality. And so what we've chosen to do at the practice is, where we've identified people who we really want to confirm their hypertension, we're sending them out a little link to a video via SMS with their consent, which is done at the front desk for all our patients in relation to using SMS messaging. And that video will run them through the process of home monitoring, and then the patients can return with a copy of that home monitor, again for the doctor to go through, identify other risks, and in conjunction with the patient's personal values, set appropriate blood pressure targets for their ongoing management, establish recalls in the clinical information system on appropriate times to check that blood pressure is at those appropriate targets, and where appropriate, if the patient has other chronic or complex health conditions and a care plan, we can include those targets into their care plan. So that's a brief rundown of how the task flow process works in Doctor's Control Panel and how you can use it. I guess with the new RACGP training coming on, we're all aware that clinical audits are a really important part of what we're doing, and I think it's important for us all to understand that those audits can be really done pretty easily using Doctor's Control Panel where we've got adequately coded diagnoses. Thanks, and I hope you enjoy playing around with some task flows. Cheers.